So, JP, a lot of patients who present to us with back pain want to have a scan to find out what's going on. How do you respond to that?
It's a very common question, as you said, and I think it kind of reflects the concern of people to want to have a look inside and see if there is a problem, because if there's a problem, you can fix it. What we know is that the vast majority of people that present with pain, like 95% of people, they don't have a structural cause for their problem. And the other thing that we know is that it is very common for us to scan people that are completely asymptomatic, that never had a history of back pain, and we find all these radiological changes. So when you scan someone, you're very likely to find something. And as you age, you're more likely to find more stuff. So when you look at that, it can drive management, because then you're trying to look at a structure to fix the structure. But the big thing is to look at how relevant is that finding on a scan in relation to the person's pain presentation. And then you got to look at all the multiple factors that can affect someone's pain experience and disability.
So can you tell me what kind of things on a scan are relevant? If I've got back pain and I've got a scan and I've got all this stuff on the scan, what are the things that we know are important?
So we know that things such as finding malignancy. So if you find a tumor, if you find nerve compression, if you have a fracture in your back, if you have spinal cord compression, when you have affecting your bowel and bladder movement. So these are really important red flags that need to be ruled out. But the important thing is that they represent about 1% of the people that present to us. So people that come to us that actually warrant a scan, it's not very common at all. What is very common is people that request a scan in a way of trying to identify why they hurt. And the other thing that we know is that once you scan someone, what you find on a scan is not very predictive of their pain now or in the future, or it doesn't really direct treatment.